All right, well, good afternoon. Thank you for the opportunity to present our work as well as to wear jeans while presenting it. Technical difficulty. All right, we have no disclosures. As we've talked about previously, obesity is increasing in prevalence worldwide as well as in the United States. And for bariatric surgery has long been the gold standard for weight loss as well as resolution of obesity-related comorbidities. Looking at the US data, sleeve gastrectomy has been the most commonly performed bariatric procedure since 2014. And while for most patients, sleeve gastrectomy works, resulting in long-term and sustainable weight loss, there's going to be a proportion of patients who experience weight regain or inadequate weight loss or develop functional problems such as refractory reflux. For those patients that have essentially failed their sleeve gastrectomy due to those reasons, there's a variety of revisions that can be performed, two of which are the Roux-En-Y Gastric bypass and then the newer single anastomosis duodenoileostomy. But direct comparisons between these two revisions in terms of their weight loss are limited in the previous literature. Thus, our aim of our study was to determine weight loss differences in revisional Chae versus Roux-En-Y gastric bypass after a previous sleeve gastrectomy. In order to do this, we conducted a single-center retrospective cohort study that identified patients at our academic institution who had undergone a previous sleeve gastrectomy and then subsequently underwent a Roux-En-Y gastric bypass or a Chae. For all patients, we collected their baseline demographics as well as operative characteristics and 30-day outcomes, and then we calculated their total and excess body weight loss up to 2 years post-operatively. In terms of our baseline characteristics, our Chae group had a higher preoperative BMI as well as excess body weight, but there were no differences in sex, age, or baseline comorbidities between our groups. When we looked at our operative characteristics, our Chae group actually had a shorter median duration of the operative time with no difference in their index hospitalization length of stay. In terms of 30-day outcomes, we actually saw a decreased rate of readmission for our Chae patients compared to our Roux-En-Y. There were no differences in need for hydration therapy, ED visits, or reoperations, so there was a trend towards increased reoperations in our Roux-En-Y group. Moving on to our total body weight loss, we saw that up to 2 years, both our Chae and Roux-En-Y group lost weight, and there were no significant differences between them at any time point. When we look at our follow-up rates, especially important in bariatric surgery, we can see that overall we had decent follow-up rates of about approximately 50% in our Roux-En-Y group, and then 60 to 70% in our Chae group up to 2 years. Looking at excess body weight loss, we saw that in the short term, our Roux-En-Y group actually had greater excess body weight loss, but there were no significant differences at 1 and 2 years. So in conclusion, we found that Roux-En-Y and Chae revisions after a previous sleeve gastrectomy had similar total and excess body weight loss at 1 and 2 years, though we did note that our Roux-En-Y group had a greater short-term excess body weight loss, and we hypothesized that this may be due to the role of the restrictive gastric pouch initially causing decreased intake and resulting in some greater short-term weight loss. When we look at the previous literature, there's only been one other study, a retrospective cohort of similar size to ours, that is compared Chae and Roux-En-Y after a sleeve gastrectomy. Interestingly, they found that their Chae group had greater weight loss than the Roux-En-Y. However, the main difference between our two study populations is actually that our Roux-En-Y group lost more weight than their Roux-En-Y group, suggesting that operative differences in how the Roux-En-Y was performed, such as limb lengths, may be contributing to those differences in our study. But given the low amount of literature on this subject, certainly in the heterogeneity of our results, indicates that further study is warranted. And then finally, we found that our Chae group after previous sleeve gastrectomy actually had decreased operative time and less 30-day readmissions compared to Roux-En-Y gastric bypass, suggesting the safety of performing a Chae after a previous sleeve gastrectomy, as well as a possible increase in efficiency in the OR. There are limitations to our study, especially the retrospective nature of it, as well as the loss to follow-up that occurred at 1 and 2 years. And in addition, our surgeons were not standardized in their procedures, so operative variation did occur within the groups and may contribute to some of the variation seen in our weight loss outcomes. And then finally, our next steps are looking at longer-term weight follow-ups, ideally up to 5 to 10 years, as well as an analysis of nutritional deficiencies between our groups. Thank you. I'd be happy to take any questions.